Okay, so we are live. Good evening, everyone, and we are live today with Dr. Shreya Bhattacharya from Indra IVF. Thank you, Doctor, for joining us.
Thank you so much for having me.
Let's just wait for some viewers to join us.
Sure, no problem.
Yeah.
I can't really see any viewers. Like, is that they're joining through a different link?
No, here on the top only. I mean,
Okay,
it's from here only. We can see,
right.
right? Yes. Okay. So, first of all, I would like to thank Shield Healthcare for arranging such an informative session with Dr. Shreya Bhattacharya. And we have already done a few sessions with you on our Facebook group and on Instagram. So, this is for our YouTube viewers now. And we have a few people who have joined. Okay. Yeah. Okay, so viewers, today we have again, I welcome Dr. Shreya Bhattacharya from, she's the IVF consultant from Indra IVF. Uh, so today we are going to talk about how to select the right IVF center. So over to you,
Yes,
ma'am.
right. I would like to wish a very good evening to all my viewers. And choosing an IVF center is a very crucial decision for all infertile couples because now there are plenty of options and there is a chance of confusion because of that. So the primary thing that a couple needs to check before choosing an IVF center is the center's success rate. What is the pregnancy rate of that center? And for that, we need to take into consideration whether it has all the latest technologies under one roof, like blastocyst culture, laser assisted hatching, ICSI facilities. These are very important because IVF is more than 40-year-old technology. It's been going around for 40 years, and there through the years, the success rate of this technology has increased because of better facilities. So to take advantage of these facilities, it must be available at your IVF center. So make sure when you decide on doing an IVF, you make sure you discuss with your doctor the treatment protocol and what all facilities are there, whether you're going for a conventional IVF or an ICSI IVF, or whether blastocyst culture is being done or not. Now there is no longer a need to transfer, day three, the 8 cell stage embryos. We can straight away transfer blasts. And the chances of success rate, the chances of an implantation is increased dramatically on transferring a blastocyst. Um, in fact, now we are moving towards elective single embryo transfers. Because of the success rate of a blastocyst implantation is so high, we are selectively transferring single embryo per cycle because we want to avoid the incidence of twin pregnancies, twin or triplets. We do not transfer more than two blasts. I do not recommend that at all because triplets are very can be get very complicated and they may need to go through with a fetal reduction at a later date where we have to reduce the triplet to a singleton or a twin pregnancy. So you make sure that you avail of these technologies like a blastocyst culture, laser assisted hatching, ICSI, and you must make sure that the best quality incubators and trained embryologist. It is very important. Only the doctor is not responsible for the success rate. It is very important to have a good lab, good quality incubators, and a good embryologist for your success. And once that is taken care of, the next thing you need to make sure is the distance. If possible, if it is possible, choose an IVF center that is closer to your home because you need to travel quite a lot to your center because of the stimulation injections, the ultrasound scans, the folliculometry scans that needs to be done. Even after you
Right.
conceive, you will have to follow up in your pregnancy. And the first trimester, the first 3 months is very crucial not just in IVF pregnancy, but in any pregnancy, because the chances of miscarriage is more in the first trimester. So
Right.
make sure you choose a center that is close to your home. And if you have a transferable job, like nowadays, we have a lot of working couples. Both partners are working, and sometimes they have transferable jobs, or both of them are posted in different cities. So in such cases, it is better if you choose a center which has multiple branches in different cities. Because in case you have to move out from one city to another, you don't have to repeat
Right.
all your investigations at each and every center. So these are the things that needs to be taken into consideration when you're choosing an IVF center. And make sure you clear all your doubts with your doctor before starting the procedure.
Right, right. So it's not just the doctor, but other parameters that also count, as you talked about, right? Okay. So
Right.
we have some viewers who are already they're asking a lot of questions, and the main question that is coming up is how to select the best IVF center only. So we just talked about uh, how to select and what are the things that they need to keep in mind. Okay, so like if we talk, yes.
No, just you continue, please. Yeah.
Okay, I was just taking
Yeah.
another. It's okay, please continue if you are saying something.
No, I just wanted to add to all the things that I said, that it is also very important that sorry, I just missed the point. Wait, I just said that it is also very important to choose the right protocol also, because it's not, the success rate is not entirely dependent on the center. It is also important, like what is your ovarian reserve, and whether you should go for a self cycle or a donor cycle. That is also very important. And another thing that I wanted to mention is that, like somebody is asking, I can see a question that whether we should continue the treatment during COVID. So yes,
Right,
actually
right,
the COVID's been going on for 2 years, and the vaccination has also been approved for pregnant women as well. So yes, I don't think IVF should be delayed because of COVID any longer, because our biological clock is ticking, because ovarian reserve will keep on decreasing. Had it been a delay of 1 or 2 months, then it would have been fine. But now it's been almost like 2 years. This has started in 2020, and now we are in 2021. So I don't think COVID should be the reason why your treatment should be delayed. Go through with your vaccination and continue with your IVF treatment. And another point that I had forgotten in the midway was that what people consider a very important criteria for choosing a center is the cost. But that shouldn't be a factor, because sometimes you have smaller centers which do not really have all those facilities which I mentioned. They're still doing conventional IVF, they're still transferring cleavage stage embryos, 3 embryos they're transferring per cycle. But the charges are less, obviously, understandably so, because they are not doing blastocyst culture and ICSI, they're not doing that. So in such cases, the cost might be less, but your success rate will also get compromised. So ultimately, you're not gaining money, you're actually losing money, because the chances of failure are higher. So that's what I wanted to
right.
add to the thing that I mentioned previously. Yes.
Right, right. Absolutely. In fact, when we hear also at Fertility Those, when we deal with a lot of clients who are going for IVF, I feel that most of them, keep in consideration the amount, the charges, the fees the IVF center is asking for. Yes, it is important, but as you said that there are so many other things that we need to see, because there could be the centers that are following the same old ways and not the new technology and new things. So that is very important, viewers. This is one point that I think you should take into consideration, and not just the money, the fees they are charging, because as ma'am said that we might be losing the money and not gaining anything. Absolutely. Okay, so let's take them many questions. Let's take up a few questions. uh, okay, what is laser assisted hatching?
Yes, like I mentioned, laser assisted hatching. See, What happens is that what how do we I'll come to laser assisted hatching. Before, I'll give you a brief overview of what IVF is and how it is done. See,
Right.
the IVF process begins with ovarian stimulation. It starts with injections. The female partner is given injections starting from usually the second or third day of her periods, and she is scanned periodically to check the growth of her follicles. Once the follicles develop into a certain size, she is given a trigger injection and a operation which is known as ovum pickup, by which the follicles, oocytes, are retrieved from her body. So that is the first part of the IVF, which includes the ovum pickup. After that comes ICSI, or in case of conventional IVF, it is fertilized by isolating the egg in a culture medium with the sperm. But now we are doing ICSI, that is intracytoplasmic sperm injection. We are injecting each sperm inside each oocyte to fertilize it. That thereby we are ensuring the fertilization. After ICSI, it usually takes 24 hours to form the cleavage stage. That is a two-celled embryo. And in approximately in 5 to 6 days, a blastocyst is formed. Okay. Now, when this embryo forms, this blastocyst forms, then it has a shell which is known as zona pellucida. Okay. This zona
Okay.
pellucida, in some cases, in case of if you're transferring frozen embryos, or if the if the female partner has PCOS, in such cases, sometimes it is seen that this zona pellucida is very thick. Okay. And when now, in case of in normal fertilization, normal conception, this zona pellucida hatches normally. Even in IVF, which in cycles where we do not go through laser assisted hatching, this zonal hatching takes place spontaneously. The zona pellucida will hatch, and the embryo will implant into the endometrium, that is the inner lining of the uterus. But in cases where the zona is thickened, in such cases we anticipate that this normal process of zonal hatching might not take place, and in such cases it would lead to failure of implantation. That is, the cycle will fail. So to prevent that, what we do before transferring these embryos, we uh, we make thin out the zona pellucida by the laser. Okay, that way we are assisting the hatching process, zonal hatching process, with the help of the laser. We thin out the zona at certain places with the help of laser, and that way we are increasing the success rate of the IVF cycle. Laser assisted hatching is recommended for people who have undergone IVF failures. Sometimes you have 2, 3 cycle failures we come across, and we cannot find any particular reason why this is happening. So, in such cases, laser assisted hatching is recommended. Even if you're going for your first cycle, in such cases also, if money is not an issue, then I think laser assisted hatching should be taken, and you can discuss it with your gynecologist and embryologist regarding the zonal thickening. If it is there, in such cases it is definitely recommended. Yes, I hope
Okay.
I was able to explain it
Yes, yes.
properly.
So that means, yes. So that means even in the first cycle, one can go for the laser assisted hatching. It's not only in the case of the
Yes, why wait
continuous.
for a failure, right? Because
Right,
in India we have a we are very impatient, and it is not like unlike UK, this IVF is not sponsored by the government. The patient has
right,
to
right,
like sponsor it themselves. So in such cases, a failure is very not just financially, even emotionally. Uh, it becomes a very big shock to the patient. So uh, I
right.
think the enthusiasm is highest in the first cycle. So it is better to do everything that can possibly be done and get a positive pregnancy in the first cycle itself. Yes.
Right, right. Okay, so hope that is clear to our viewers. Okay, there's one more which says, what are the different types of IVF?
Right. So we can classify IVF based on the stimulation protocol, but that would be more complicated. The easier thing is classifying based on the gametes we are using. If we are using the self gametes, we are using the wife's ova, egg, and the husband's sperm, then it is a cell cycle IVF. Okay, we are producing the biological offspring of that couple. But sometimes, in case of, if uncorrectable problems in the patients, when the wife is menopausal, there is no ovarian reserve left in her, so there's no other option but to go for a donor cycle. We have to take the egg from outside and use the husband's sperm. In that case, we call it a OD cycle, that is a ovum donation cycle. Sometimes we have to
Okay.
go for an embryo donation cycle also, or because even the husband's sperm is deficient and it cannot be correctable either medically or surgically. So then it becomes an embryo donation cycle. There are all possible combinations. We sometimes go for a self egg donor sperm cycle. All these things
Right.
are done. It is done mainly in cases where repeatedly donor semen IUI is failing, or there is a tubal factor in the women along with a male factor in fertility. So these are done. In case of a self cycle, there are different protocols. There is a long protocol, short protocol. Then there is a minimal stimulation protocol, which is very popular now, especially in low reserve women. The cost of a
Right.
minimal stimulation protocol is lesser, and the chances of getting a good quality embryo is higher in case of a minimal stimulation protocol, but it is usually done in women who are at a higher age group and who has lower ovarian reserve. So these are the things. I'm giving you a brief, like a overall, like a brief overview of the
Right.
types.
Right.
Specifically, you have to discuss with whoever you're consulting, and upon seeing your reports, your doctor will suggest which protocol is best for you, and it is customized according to you. Okay, because we based on your reserve and your age, your BMI, the dose is curated to the patient. Yes.
Right. So basically, it depends on the person to person. What is the requirement? What the report says? What is the age? A lot of factors that are associated with what type of IVF cycle should be done on that particular patient.
Right.
Okay. Okay. So we'll take two, three more questions. Uh, what if I am infected with COVID-19 after starting my fertility treatment?
Yes, that's a very good question. And in fact, I recently had a patient. She had undergone IVF. She had an embryo transfer. And since the government had allowed the COVID vaccine only for pregnant women only from, I think, 25th June. So before
Right.
that, we could not vaccinate our pregnant women. So, and plus the dosage schedule is such that the patient could not even take the first dose, because after embryo transfer we could not like give her the second dose, so that way she could not even take the first dose. So we did the embryo transfer. Luckily she conceived also with twin pregnancies, and in her first trimester itself she was diagnosed with COVID. Not just her, her entire family, she, her husband, her mother, oh, the whole family had COVID. So that got us really worried, because certain therapies in COVID cannot be allowed in pregnancy because that would endanger the fetus.
Right.
COVID itself does not harm the fetus. It is not a teratogenic virus as of now, what the data is showing till date. It does not directly harm the fetus. But yes, if it becomes severe and the mother needs ICU care, in such cases, indirectly, obviously, the fetus will be affected. So now
Right.
we are
Right.
very lucky that the government is allowing vaccination for pregnant women. So it is very important that they get vaccinated as soon as possible. But in most cases, even if you're infected during treatment and it is a mild infection, then it will not hamper your pregnancy outcome. If you have become infected, suppose after your ovum pickup, I would suggest you delay your embryo transfer till you're feeling better. And
Okay.
in a rare case, if you become positive during a stimulation, it depends at what stage of stimulation you are. If you just receive one or two doses, I would suggest we should postpone the cycle. And if you're towards the end of your stimulation and you've become positive, if you're asymptomatic, in such cases, you should discuss with your doctor and the risks and benefits. And you can even go through with your ovum pickup with all the precautions that can be taken. Because now we are doing ovum pickup even under spinal anesthesia. GA is not needed as such, because it is a like it's not necessary as such. So in such cases, if you're COVID positive, your report has come positive, and you're still asymptomatic. So in such cases, ovum pickup can be done. It is not entirely contraindicated, but that needs to be discussed with the anesthetist, with your treating doctor, and the decision needs to be reached based on that. But yes, if you become positive after ovum pickup and ET has not yet been done, then I would suggest freeze your embryos, delay it till you're feeling better, your RT-PCR report comes negative. And if you're
Right.
positive during pregnancy, then if you're vaccinated, most likely you'll have a mild infection. So there's nothing to worry. You have to consult your physician, and you can take antibiotics. The antibiotics which you have given, azithromycin, the ones that are being prescribed mostly are safe in pregnancy. So you can do that.
Right.
Paracetamol is safe in pregnancy. So if supportive care is all you need, then it's fine. And if it becomes severe, then it is a problem. I won't deny that. So that is why it is very important to get vaccinated and maintain all the necessary precautions.
Right. So those who are planning for any infertility, the treatments and all, IVF and all, for them it should be first vaccination and then the treatment.
Yes, or you can get vaccinated during treatment also. Like once you're starting stimulation, you can take your first dose, and if you're taking co-vaccine, then your vaccination will be completed within 1 month. And even if you're taking Covishield, no harm in that. Uh, but then it will take a very long time. It will take 84 days for you to complete the vaccination. So in such cases, I would suggest you take the first dose, and since it's safe in pregnancy, you can uh, complete your ovum pickup, embryo transfer, and then later on, after first trimester, you can take your second dose. So I think that would be a better way than to like wait for to complete both doses and then go for IVF, because that would be like
Right.
in case of Covishield, we have to wait 3 months to
Three
complete.
to 4 months. Right.
So
Right.
yes, yes, yes.
Right. Okay. Okay. So next we'll move on to the next question. It says I'm 35-year-old planning to go for an ovarian PRP for low AMH. Please advise.
Yes, right. I see the question. Yes. See, PRP, that is platelet-rich plasma. See, it is used for two purposes. One is for low variant reserve, which I think that is why she's been recommended that because her AMH is low. But we rather prefer using PRP for thin endometrium. That is also a therapy because it increases it has certain cytokines and certain ingredients it has which increases the vascularity and causes more like a rejuvenating process. It is also done, even in the beauty sector. You've come like you might have come across these treatments in your beauty parlor or salons like vampire facial and these kind of things. Mostly it is a rejuvenating therapy. It rejuvenates aging tissue. So that is why though 35 is not really that high an age, but in some patients we have seen, even in very young patients, the AMH starts decreasing even at a earlier age. Even at
Right.
25 also we've come across patients whose AMH is very low. So yes, but PRP is there's still very little data about PRP therapy in case of low AMH, that is ovarian PRP, and there is a risk since it's a blood product. Like they will be taking your blood and separating the platelet-rich plasma and then injecting it into your ovaries. Since it's a blood product, there will be a chance of infection and certain things, certain precautions need to be taken. So it is still not like not much data is there for these kind of therapies. But if AMH is low, and since we women function like this, that eggs are not created, we are not new eggs are not being born in our body. We are born with a fixed ovarian reserve, and once it is
Right.
gone, it is very difficult to retrieve it. Any therapy we do is actually to salvage whatever eggs that are remaining. So yes, since if the patient, if you are very particular that you want your own eggs to be used for your IVF, then you can go through with it. But I would suggest you maintain all the necessary precautions and take your antibiotics because there is a chance of infection in such cases. Yes.
Right. Okay. Thank you for this.
Easier option would be, if your reserve is very bad, you can go for a donor cycle if that is acceptable to you. But if it's not, then yes, you can give ovarian PRP a shot. Yes.
Okay. So, with AMH as 5.7, can I conceive naturally?
See, AMH of 5.7 is quite good. Anything above 2 is good actually, but it is not only your ovarian reserve that needs to be taken into consideration for whether you
Right.
can, to judge whether you can conceive naturally or not. We need to see three things mostly. We need to see your ovarian reserve, which according to this AMH report is quite good. Secondly, we need to know the semen parameters of your husband, whether his count, motility, morphology, vitality, all these four parameters that we normally see in a normal semen analysis report, whether all those things are uh, uh, I mean, normal or not. And nowadays, we are also doing DFI, that is a DNA fragmentation index of sperm. So you can check that if because smoking is very common nowadays. In case such cases, we've seen a lot of cases of DFI, higher DFI, and if DFI is higher than 30%, then there is a high chance of defective embryo formation, and miscarriage rate is higher. So even DFI can be checked. But most importantly, basic semen analysis needs to be done. Okay, that is the
Right. Right.
second thing. The third thing is your uterus and your fallopian tubes. It's very important to have a healthy endometrium and patent, that is open fallopian tubes. If your tubes are blocked and you have good reserve and your husband has great sperms, there's no point, because if both tubes are blocked, the sperm will never reach the egg and there will be no fertilization and thereby no pregnancy. So these three things need to be taken into your consideration. Your ovarian reserve is good. Now check your tubes and your uterus and your husband's sperm. If all three are good, then you can try for natural pregnancy for 1 year. Okay, if you can, if
Okay.
you're younger than 35, you keep trying for 1 year. If you can't conceive, then you can consult a doctor, get investigated, or and treat it. Or if you're older than 35, then you really don't have that much time. You try for 6 months. If you can't conceive naturally, then you can consult your doctor. Yes.
Okay. Okay. So, as you just mentioned about tubes, there's one question which says, please explain the difference between HSG and saline water test for tubal patency.
Right. So these are two commonly done tests for to check the tubal patency. HSG is hysterosalpingography. It is done via an X-ray. Like a dye is pushed into your uterus, and an X-ray is taken of your abdomen to see if that dye is coming out of the tubes. Okay, the dye is radio opaque, so it is visible on a X-ray. In saline infusion sonography, an ultrasound is done. See, both tests have certain pros and cons. See, the advantage of a HSG is that it clearly delineates both tubes, because it is a radio opaque dye is injected and we are taking an X-ray. We can see the uterine cavity and both tubes, and whether the dye is coming out from both tubes or not. In case of saline infusion sonography, it is difficult. One advantage is that there's no radiation exposure, because X-ray uh, gives you a little amount of radiation exposure, which is not good for your ovaries. So that is a disadvantage of an HSG. While in case of SSG, it is like I've taken patient feedback. The patients say that it is comparatively less painful than an HSG, and there is less. There's no, in fact, no radiation exposure, but sometimes it is difficult to make out, like whether the fluid, whether the saline is coming from which tube. Normally, we can delineate the uterine cavity, and we can, locate fluid on the POD, that is the pouch of Douglas. But we cannot really make out if the both tubes are open or not. No, we just push water saline into the cavity and we see the whether there's fluid in the POD or not. But in some patients, it is not very clear whether the right tube is giving rise to that fluid, or whether the left tube is giving rise to the fluid. In some patients, the anatomy is very clear. We can make out in real time that the fluid is flowing through this either tubes or not, either or both the tubes. But in certain patients, we can see the fluid, but it can be possible that one tube is still blocked and only one is open, and we cannot make out which one. We can just see the
Which?
fluid. So, in terms
So
of results,
HSG.
I feel HSG is clearer, but then it has certain disadvantages. It is comparatively more painful, and there is a certain amount of radiation exposure. Yes.
Right,
So
right.
you discuss these things with the doctor who's prescribing these tests to you, and accordingly make a informed choice. Yes.
Great, great. So, this live session, I think many of them are getting so many valuable facts and answers. Thank you for this, and we have so many more questions. Our viewers want to ask so many other things. Let me get back to another question. That is, which vaccine is allowed for pregnant women for COVID? Can they go for any?
Right. See, yes, see, as of now, both vaccines have been labeled safe in pregnancy, that is Covishield and Covaxin. But it is being said that patients who have too many comorbidities, like she's hypertensive, diabetic, there is some like any blood disorders are also there, maybe thrombophilia, which usually give rise to recurrent pregnancy loss or even infertility. In such patients, maybe Covaxin is considered safer because there is certain data that Covishield causes certain blood clotting disorders. So, in such cases, if a patient has a lot of comorbidities like hypertension, diabetes, and other blood disorders or clotting disorders, in such cases, Covaxin would be considered safer. But otherwise, in case of in any normal woman without any risk factors, either vaccine can be taken, either Covaxin or Covishield, whichever is available to you, you can go through with that.
Okay, so she says, I'm 19 weeks pregnant. Can I go for the vaccine?
Yes, please do as soon as possible. In fact, now is a very good time for you to take the vaccine because since you're already in your 19th week, the first trimester is over. That is the period of organogenesis, where the organs are still forming in the baby. That time is over. So, uh, during the first 3 months, it is very important that you do not take any as little medications as possible because that is the time when the drugs have a direct influence on the formation of your baby. So since it is over, you like think no further. You get yourself vaccinated as soon as possible, and take whichever
Right,
vaccine
right,
which is available to you if there is no other comorbidities involved. Yes.
right. Thank you, doctor. Okay, so next one says, is there a test to check how strong your eggs are?
See, there is nothing like the strength of your eggs. What you have to check is your quality, is the quality and the quantity. Now, the quality is very difficult to assess. Mostly, it is assessed through, it is considered that the quality decreases with age. And by quality, I mean the DNA makeup of the eggs. Quantity is easier to check. We check the antral follicle count, that is in your TVS scan. TVS scan, we check the number of follicles that is visible in your ovary. That's the AFC count. And then your AMH, anti-Mullerian hormone, needs to be checked whether if it is usually it is within 2 to 5 if you are having a good reserve or higher, or if it's less than 2, then it is slowly depleting in such cases. So that is the quantity. What you can check is the quality or the chromosomal makeup of your embryos. So, in case you're in a higher age bracket, and if you have a family history, or even if you have one child with any chromosomal, known chromosomal or genetic anomaly, in such cases, you can go for a PGTA or a PGTS. That is a pre-implantation genetic testing. That is where we biopsy the embryo and we see if it is positive for any known chromosomal anomalies. Usually we check for Down syndrome, trisomy 13,
Right,
trisomy 18. So these things need to be checked if you're, if you're above 35 or even above 40. Also, we are getting a lot of patients above 40. In such cases, you should check if your PGTA is normal, if the embryos are euploid, that is, they're chromosomally normal or not. And if you have an euploid embryo, even transferring one embryo is enough because in such cases, and miscarriage due to chromosomal anomalies is reduced. So nowadays we are moving towards that. We are doing PGTA and we are transferring one euploid embryo if the patient is okay with that. So yes, that is the way you can check the quality of your embryo. which is what ultimately matters, because only checking the quality of an egg is not ultimately gives you no benefit. After, if you're going through an IVF, after an ovum pickup, your doctor will usually tell you the by quality I mean the maturity of your eggs, whether the how many M2 oocytes have been retrieved, how many M1, how many GV oocytes have been retrieved. See, GV and M1 are basically immature eggs, and they will not give rise to a good quality embryo. So usually ICSI is not done upon them. Where I'm
Okay.
working, we usually do ICSI on the M2 sites. M2 sites are your best mature eggs, which can be fertilized and which can lead to your a good quality embryo. So yes, then if your AMH and AFC is good, there's a high possibility you will have a more number of M2 sites. And if you have more number of M2 sites, there are chances that you will have more number of embryos. And to check the quality of those embryos, a PGTA or a PGTS can be done. So I hope that answers your question.
Okay.
Yeah.
Yes, yes. Thank you so much. Okay, so there are two questions, or almost similar questions, which says that I have heard that IVF babies are mostly premature in birth. The when
See,
we,
yeah. I understood the question. See, the thing is, I won't exactly deny it that IVF babies can have premature birth, but it is not because of the fact that it is an IVF conception. What happens is that in case of IVF, since we are normally transferring two embryos, there is an increased chances of twin pregnancies. And in every twin pregnancy, not just in IVF, in even natural twin conceptions also, the chances of preterm labor is higher, because see, the normally the uterus is accustomed to holding one fetus, but when you have two fetuses, it enlarges disproportionately. Like even at a later gestation, it feels that it has reached term gestation, because even maybe in the second trimester itself, late second trimester, it is, because it is accommodating both fetuses, it is
right,
enlarged to as if it has reached the third trimester. Like there is this thing, so that is why it feels as if it is time to deliver now. So the labor pain starts earlier. And
right,
once labor develops, there's no way to stop it. So the baby needs to be taken out. Either it is delivered vaginally or it needs to be taken out by a cesarean section, depending upon the complications in that pregnancy. And it leads to a lot of comorbidity actually, because if the babies are underweight, they need to be kept in the NICU for prolonged periods, leading to a lot of anxiety to the parents, and also a lot of financial burden to the patients. So yes, that is the reason we are now moving towards a single embryo transfer. That way, it will cause a singleton pregnancy, and the chances of a preterm birth will be reduced, because in case of a single preterm birth, the chances of preterm birth can still occur, but the chances are quite low, because the uterus, unhealthy uterus, if there's no malformation, then it can be accommodate a single fetus for the entire periods of 30 to 40 weeks. That is the term gestation. So that is why it is important you go for a PGT and a single embryo transfer.
right, right. Okay, and this is very common thing that even I have heard from people asking that whether the IVF, the children through IVF, whether they have the normal development or not. That I
Yes,
mean,
absolutely. See, if you are, conceiving, if your IVF is done by your eggs and your husband's sperm, it is entirely your baby, and it will have all the qualities or even the shortcomings. Whether, see, if there's a family history of diabetes in your family, the baby will obviously have a predisposition for it, whether you're conceiving by IVF or whether you're conceiving naturally. So there is no such thing that IVF babies will have any developmental anomaly just because it is an IVF pregnancy. In fact, in case of an IVF, you have the opportunity of doing a PGTA. Like you can biopsy the fetus and check if it is euploid, or if it has any known congenital anomaly, which maybe if it runs in your family. So that option is not even there in case of a natural conception. So please do not shy away for getting treated if you think that IVF will lead to a malformed baby. all the precautions that are taken in a natural pregnancy, like we do the anomaly scan, the first trimester combined screening test, all these things are done even in an IVF pregnancy. And if it is done with your egg and your husband's sperm, it is done with your egg and your husband's sperm. There is no
I think there was some network issue. We lost connection with her. So, yes, she's
There
there
was a
again.
connection problem, right? I seem to have lost
Yes.
the connection.
Due to some network issues, we lost you for a while.
Yeah, yeah. So yes, I was. What was I talking about? I
Ma'am, you're
seem to
not
have lost
audible.
my train.
Not
Uh,
audible.
Wait. Hello, can you hear me?
No, 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 no.
Wait, I'll just
So,
open the headphone. Wait, let
for our
me.
viewers, if you wish to be in touch with Dr. Streya, or if you feel that you need to go for a consultation with her, you can contact us. You can contact Fertility Those team,
Is
and
this better?
do
Is this
subscribe to our
better?
YouTube channel, and so that you get the timely updates for all our informative session. And today's was an equally informative session. We got to know a lot about a lot of things, a lot of knowledge, lot about IVF and COVID related questions are also solved. Uh, Ma'am, am I audible?
I can hear you. Can you hear me?
Yeah, but no, but you are not audible. Mm,
Okay. I don't know what is wrong here.
no. So it's fine. We have almost taken all the questions. If there's any question left, we'll get the answers from Dr. Shreya. And so I'll end as we are unable to
Hello, is this
hear
better?
from you. No, no,
I don't know
no,
what is
no,
going on.
no, no issues. I'll end the line here, and it was a pleasure talking to you. Thank you so much for all the information. Thank you.
Thank you.
Thanks a
Thank you.
lot. Thank you.
Thanks.